Hello, everyone, and welcome back to your daily dose of English, where learning English is easy, fun, and practical. I'm Tom.
And I'm Sara. Hi, Tom. How are you doing today?
I'm doing great, Sara. Feeling healthy and happy. How about you?
I'm wonderful, thank you. And speaking of being healthy, before we dive into today's topic, we have a small request for all of you listening right now.
That's right. If you're enjoying our podcast and finding it helpful for your English learning journey, please take just a moment to subscribe to Your Daily Dose of English. It really helps us reach more English learners around the world.
Yes, and don't forget to give this episode a thumbs up and share it with your friends who are learning English. Your support means everything to us.
Absolutely. And now, Sara, I'm really excited about today's topic because it's something every single person needs to know, especially if you're living in an English-speaking country.
Oh, I can't wait to hear what it is. What are we talking about today?
Today we're going to talk about one of the most important places you'll visit when you're not feeling well. We're talking about going to the pharmacy.
The pharmacy. Oh, that's such a practical topic, Tom. Everyone needs to go to the pharmacy at some point.
Exactly. Whether you need medicine for a headache, vitamins to stay healthy, or you have a prescription from your doctor, knowing how to communicate at the pharmacy is super important.
It really is. And I have to say, the first time I went to a pharmacy in an English-speaking country, I felt a little nervous. There are so many medical words.
That's totally normal, Sara. Medical vocabulary can feel intimidating. But here's the good news for everyone listening.
What's the good news?
The good news is that you don't need to know every medical term. You just need to know some basic phrases and common words, and you'll be able to get exactly what you need at the pharmacy.
That's so reassuring. So today we're going to help our listeners feel confident about going to the pharmacy and getting medicine and health products in English.
Yes, we'll cover everything. How to ask the pharmacist for advice, how to fill a prescription, how to describe your symptoms, how to understand medication labels, and even how to buy other health products like vitamins and bandages.
Wow, that's a lot. This is going to be such a useful episode. I think our listeners will feel so much more prepared after this.
I hope so. And you know what, Sara? Let's make this fun and interactive. How about we do a role play later where you're the customer and I'm the pharmacist?
Oh, I love that idea. Role plays are the best way to practice real conversations.
Agreed. But first, let's start with some basics. Sara, can you tell our listeners what exactly is a pharmacy?
Sure. A pharmacy is a store where you can buy medicine and health products. In some countries, people call it a chemist or a drugstore, but pharmacy is the most common word in the United States, Canada, and many other English-speaking countries.
Perfect explanation. And who works at the pharmacy?
The person who works there is called a pharmacist. The pharmacist is a medical professional who knows a lot about medicine. They can give you advice, fill your prescriptions, and answer your questions about how to take your medication safely.
That's right. And here's an important thing to remember. In most English-speaking countries, pharmacists are very friendly and helpful. They want to help you, so don't be shy about asking questions.
That's such good advice, Tom. Sometimes people feel embarrassed to ask questions, especially in a second language. But pharmacists are there to help you stay healthy.
Exactly. Now let's talk about the different reasons people go to the pharmacy. Sara, what's the most common reason?
I think the most common reason is to fill a prescription. A prescription is a special paper or electronic order from your doctor that tells the pharmacist what medicine you need.
Yes. So if you go to the doctor and they say you need antibiotics or special medicine, they'll give you a prescription. Then you take that prescription to the pharmacy.
Right. But that's not the only reason people visit the pharmacy, is it?
No, definitely not. You can also go to the pharmacy for over-the-counter medicine. Over-the-counter means you don't need a prescription from a doctor. You can just buy it directly.
Oh, like medicine for a headache or a cold?
Exactly. Things like pain relievers, cough syrup, allergy medicine, these are all over-the-counter medications.
And what about other health products? Can you get those at the pharmacy too?
Absolutely. You can buy vitamins, supplements, first aid supplies like bandages and antiseptic cream, thermometers, and even things like contact lens solution.
So, the pharmacy is really a one-stop shop for all your health needs.
It is, and that's why it's so important to feel comfortable communicating there in English. Okay, Sarah, are you ready to learn some key phrases and vocabulary?
I'm so ready, Tom. Let's do this.
Great! Let's start with the most common situation. Filling a prescription. Imagine you have a piece of paper from your doctor. You walk into the pharmacy. What's the first thing you say?
I think you can say, "Hello, I have a prescription to fill."
Perfect. That's exactly right. I have a prescription to fill. Or even simpler, I need to fill this prescription, please. Both are great.
And then what happens? Does the pharmacist take the paper right away?
Usually, yes. The pharmacist will take your prescription and might ask you, "Can I see your ID?" Or, "Do you have insurance?"
Oh, insurance. That's important to know about. In many countries, like the United States and Canada, if you have health insurance, your medicine might cost less money.
That's right. So the pharmacist might ask, "Do you have insurance?" You can answer, "Yes, here's my insurance card," or "No, I don't have insurance."
What if you're a visitor or a tourist and you don't have insurance there?
No problem. You could just say, "I'm paying out of pocket," or "I'll pay cash." Out of pocket means you're paying the full price yourself without insurance.
Okay, so you give them your prescription and your ID and maybe your insurance card. Then what?
Then the pharmacist will usually say something like, "Okay, it'll be about 15 minutes," or "It'll be ready in 20 minutes." They need time to prepare your medication.
So you wait. You can look around the store, maybe buy some other things you need.
Exactly. And when your prescription is ready, they'll call your name. You go back to the counter, the pharmacist will give you your medication and explain how to take it.
This is the really important part, right? Understanding the instructions.
Super important. The pharmacist might say things like, "Take 1 pill twice a day with food," or "Take 2 tablets every 4 hours as needed for pain."
Let me make sure I understand. Twice a day means 2 times per day, right?
Yes. And with food means you should eat something when you take the medicine. It's better for your stomach.
What about as needed? What does that mean?
As needed means you don't have to take it on a schedule. You only take it when you need it, like when you have pain.
Ah, I see. So, if I have a headache, I take it. if I don't have a headache, I don't need to take it.
Exactly right. The pharmacist will also tell you important warnings. They might say, don't drink alcohol while taking this medicine, or this may make you drowsy.
Drowsy means sleepy, right?
Yes, drowsy means you might feel tired or sleepy. So if a medicine makes you drowsy, you shouldn't drive a car or operate machinery.
That's really important information. So, when the pharmacist is explaining all of this, what if you don't understand something? What should you say?
Great question. You can always say, I'm sorry, can you repeat that, please? Or can you explain that again? Or I don't understand, can you say it more slowly?
Those are perfect phrases. Don't be afraid to ask for clarification. It's about your health.
Absolutely. And here's another useful phrase. If you want to make sure you understood correctly, you can repeat it back. You can say, so I should take 1 pill in the morning and 1 at night. Is that correct?
Oh, I like that. Repeating it back helps you confirm you understood.
Yes. And the pharmacist will say, yes, that's right. Or they'll correct you if you misunderstood.
This is all so helpful, Tom. But what about when you don't have a prescription? What if you just have a small problem like a headache or a cough?
Great question. That's when you ask the pharmacist for advice about over-the-counter medicine. This is super common.
Okay, so how do you start that conversation?
You can walk up to the counter and say, excuse me, can you recommend something for a headache? Or, I have a cough. What do you suggest?
So you describe your symptom and ask for a recommendation.
Exactly. Let's practice describing some common symptoms. Sara, how would you describe having a headache?
I would say, I have a headache or my head hurts.
Perfect. What about a sore throat?
I have a sore throat or my throat hurts when I swallow.
Great. And if you have a cold with a runny nose?
I have a cold and I have a runny nose.
Excellent. What about a cough?
I have a cough or I can't stop coughing.
Very good. And stomach problems?
I have a stomachache or my stomach hurts.
Perfect. Now, when you describe your symptoms like this, the pharmacist will usually ask you some follow-up questions to help you find the right medicine.
What kind of questions?
They might ask, how long have you had this? You can answer for 2 days or since yesterday or just today.
Okay, that makes sense. What else might they ask?
They might ask, are you taking any other medications? This is important because some medicines don't work well together.
So you should tell them about any other medicine you're taking?
Yes, you can say, yes, I'm taking medicine for high blood pressure. Or, no, I'm not taking anything else.
What if you have allergies to certain medicines?
Great point. You should always tell the pharmacist if you have allergies. You can say, I'm allergic to penicillin. Or, I can't take aspirin.
And the pharmacist will make sure to give you something safe.
Exactly. Based on all this information, the pharmacist will recommend a product. They might say, I recommend this pain reliever. Or, this cough syrup should help.
And then you can buy it and use it according to the instructions on the label.
That's right. Speaking of labels, let's talk about how to read medication labels. This is so important.
Yes, because even if the pharmacist explains it, you need to be able to read the label at home.
Exactly. So on a medication label, you'll see several important pieces of information. First, you'll see the active ingredient. This is the medicine that actually helps you.
Okay, so that's the important chemical or substance that treats your problem.
Yes, then you'll see directions for use. This tells you how much to take and how often.
Like, take 2 tablets every 6 hours?
Exactly. You'll also see warnings. This might say things like do not exceed the recommended dose, or do not use if you are pregnant.
Exceed means go over or take more than, right?
Yes, don't take more than the label says. It can be dangerous.
What else is on the label?
You'll see side effects. These are other things that might happen when you take the medicine. Common side effects might include drowsiness, upset stomach, or dizziness.
Dizziness is when you feel like the room is spinning or you might fall, right?
Yes, and finally you'll see the expiration date. This is the date when the medicine is no longer safe to use.
So if it says EXP 2026, that means don't use it after December 2026.
Exactly right. Always check the expiration date before taking any medicine.
This is all such important information. I feel like I'm learning so much.
Me too. Now let's talk about some other common things people buy at the pharmacy. What about vitamins and supplements?
Oh, yes. Lots of people take vitamins every day to stay healthy.
Right. Common vitamins include vitamin C, vitamin D, multivitamins, and calcium. If you want to ask the pharmacist about vitamins, you can say, "Where can I find the vitamins?" Or, "Can you recommend a good multivitamin?"
And what about first aid supplies? What if you cut your finger or twist your ankle?
Good question. You can buy bandages which are also called band-aids. That's actually a brand name, but many people use it for all adhesive bandages.
Like Kleenex for tissues?
Exactly. You can also buy gauze for larger wounds, antiseptic cream or ointment to prevent infection, and medical tape.
What if you need something for pain or swelling?
You can buy ice packs for swelling or pain relief patches. If you sprain your ankle, you might need an elastic bandage, also called an ACE bandage, to wrap it.
So the pharmacy really has everything you might need for minor injuries.
It does. Okay, Sara, I think it's time for our role play. Are you ready?
I'm ready. This is going to be fun.
Great! I'll be the pharmacist and you be the customer. Let's do 2 scenarios. First, you have a prescription to fill.
Okay, here I go. Hello, I have a prescription I need to fill, please.
Of course. May I see your prescription and your ID?
Sure, here they are. And here's my insurance card too.
Perfect. Let me check this. Okay, Miss Sara, this will be ready in about 15 minutes. Is that okay?
Yes, that's fine. I'll wait. Thank you.
You're welcome. I'll call your name when it's ready. Okay, 15 minutes later. Sara, your prescription is ready?
Great, thank you. How much is it?
With your insurance, it's $10. And let me explain how to take this. You should take 1 tablet twice a day, once in the morning and once in the evening. Take it with food.
So, 1 in the morning with breakfast and 1 in the evening with dinner.
Exactly. And don't drink alcohol while taking this medication. It can make you feel dizzy.
Okay, I understand. No alcohol. How long should I take this?
Take it for 7 days. Even if you start feeling better, finish all the tablets.
Got it. Thank you so much for your help.
You're very welcome. Feel better soon.
Wow, that felt so real, Tom. Okay, now let's do scenario 2. This time I need over-the-counter medicine.
Perfect. Go ahead.
Excuse me, can you help me? I have a terrible headache and I'm not sure what to take.
Of course. How long have you had the headache?
Since this morning. It's been about 3 hours.
Okay. Are you taking any other medications?
No, I'm not taking anything else right now.
Do you have any allergies to medications?
No allergies that I know of.
Great. I recommend this pain reliever. It's ibuprofen. Take 2 tablets with water. You can take it every 4 to 6 hours if needed, but don't take more than 6 tablets in 24 hours.
Okay, 2 tablets every 4 to 6 hours. Maximum 6 tablets per day.
That's right. And take it with food or milk to protect your stomach.
Perfect. Thank you so much. Where can I find this?
It's in aisle 3, on the middle shelf. Just follow the signs for pain relief.
Great. Thank you for your help.
You're welcome. I hope you feel better soon.
That was great practice, Tom. I think our listeners can really learn from those examples.
I agree. The key is to be clear, polite, and don't be afraid to ask questions. Now let's quickly review some of the most important vocabulary from today's episode.
Good idea. Let's start with prescription. That's the paper from your doctor that tells the pharmacist what medicine you need.
Next, over the counter. This means medicine you can buy without a prescription.
Pharmacist, the medical professional who works at the pharmacy and helps you with your medications.
Fill a prescription. This means to get your medicine prepared at the pharmacy.
Dosage. This is how much medicine you should take.
Twice a day or 3 times a day. These describe how often you take the medicine.
Side effects. These are other things that might happen when you take medicine, like feeling drowsy or having an upset stomach.
Expiration date. The date when medicine is no longer safe to use.
Active ingredient. The substance in the medicine that treats your problem.
An allergic. If you're allergic to something, it causes a bad reaction in your body.
Those are really the key words everyone needs to know. What about useful phrases, Tom?
Sure. I have a prescription to fill. Can you recommend something for... How often should I take this? What are the side effects? I'm allergic to... When will it be ready? Can you repeat that, please?
Those phrases will help you in almost any pharmacy situation.
Absolutely. Now, before we wrap up, let's talk about some cultural differences in pharmacies around the world.
Oh, that's interesting. What should people know?
Well, in the United States and Canada, many pharmacies are inside larger stores. You might have a pharmacy inside a grocery store or a big retail store.
Right. So you can buy medicine and also do your regular shopping.
Exactly. In the UK, they call it a chemist, and there are many independent chemists on the high street, which is the main shopping street.
And in Australia, they say chemist too, or sometimes pharmacy.
That's right. Another cultural thing is that in the US, many pharmacies are open 24 hours, especially in big cities. This is really convenient if you need medicine late at night.
That's really different from some countries where pharmacies close at 6 or 7 p.m.
Yes. Also, in English-speaking countries, pharmacists are very approachable. They're not just there to give you medicine, they're there to answer questions and give advice.
So don't be shy. They really want to help you.
Exactly. And one more thing. In many countries, you can now order your prescriptions online and have them delivered to your home, or pick them up without waiting.
That's so convenient, especially if you're busy or not feeling well.
It is. Many pharmacies have apps now where you can request refills, track your prescriptions, and even have video consultations with a pharmacist.
Technology is making healthcare so much easier.
It really is. Okay, Sara, do you have any final tips for our listeners?
Yes. My biggest tip is to write down the name of your medicine and how to take it. When you're not feeling well, it's easy to forget instructions.
That's excellent advice. My tip is to always bring your prescription bottle back to the pharmacy if you have questions. The pharmacist can look at it and help you better.
Oh, that's smart. And always finish your antibiotics even if you feel better, unless your doctor tells you to stop.
Very important. And my last tip is to build a relationship with one pharmacy. If you always go to the same place, the pharmacists get to know you and your medical history.
That's true. They can catch problems like medicine interactions if they know what else you're taking.
Exactly. Well, everyone, we've covered so much today. I hope you feel more confident about going to the pharmacy and communicating in English.
Me too. Remember, the pharmacy is there to help you stay healthy. Don't be afraid to ask questions. Ask for help and make sure you understand everything about your medicine.
And practice these phrases at home. Say them out loud. The more you practice, the more confident you'll feel.
That's right. And if you make a mistake, that's okay. Everyone makes mistakes when learning a language. The important thing is to try.
Absolutely. And speaking of trying, we want to hear from you. Leave us a comment below and tell us what's one new word or phrase you learned today about going to the pharmacy.
Yes, we read all your comments and we love hearing from you. It helps us know what's useful and what you want to learn more about.
And please, if you found this episode helpful, subscribe to Your Daily Dose of English. We post new episodes every week to help you improve your English with practical, real-world topics.
And share this episode with your friends, your family, anyone who's learning English. Sharing is caring.
It really is. All right, everyone, that's all we have time for today. Thank you so much for joining us.
Yes, thank you for listening. Take care of your health, keep practicing your English, and we'll see you in the next episode.
Stay healthy, stay happy, and keep learning.
Bye for now, everyone.
Goodbye. See you next time on Your Daily Dose of English.